And as we've seen during this pandemic, the virus really affects people differently. And there are a lot of what ifs and questions right now.
So we have Dr. Aimee Becker. She is the Chief Medical Officer at UW Health, that is, and she joins us now to hopefully answer some of the uncertainties regarding President Trump's situation. Thank you very much for being here. We know you have not seen the president or know exactly what is happening with him, but give us a timeline of what things might look like for him.
Yeah, so I wouldn't want to weigh in on the president's specific course, as that is very individual and unique. I would say, for anybody with COVID-19, it's a serious illness, and certainly I wish him and the First Lady a speedy recovery. I think when we talk about how we're impacted, each one of us individually, by any medical illness, COVID-19 included, it really comes down to our different risk factors. And those risk factors aren't absolutes, but certainly they can portend to more serious illness.
Yeah, obviously, it always depends on the person. What about the president's age and the fact that he's a male? Doesn't this virus seem to attack men in a different way than women and sometimes cause more severe reactions, doctor?
Yeah, so when we think about the risk factors for serious illness with COVID-19, age is, really top of the list. We know that with each increasing decade, our risk for serious illness with COVID-19 and hospitalization does go up. We also know that there are certain medical conditions that put us at higher risk for serious illness with COVID-19. A couple examples of those would be, cancer or the immune suppression from solid organ transplantation, like a kidney transplant. And then there are other things that are very likely to increase the risk, like asthma or emphysema, for example.
We often hear people are symptomatic or asymptomatic. What is the difference and what does that mean for someone?
Yeah, so asymptomatic means someone has COVID-19 but does not have any symptoms. And symptomatic means we have some symptoms of COVID-19. We know those symptoms are a whole laundry list of different symptoms, and each one of us is impacted differently for those symptoms. So most commonly, fever, cough, then shortness of breath, headache, sore muscles, fatigue, even nausea, diarrhea, all on the spectrum of illness. And so when we talk about symptomatic, we were talking about patients having, or people having, some number of those symptoms.
It's so complex. Dr. Aimee Becker, we appreciate you being with us, at least to explain something, because all of us have a lot of questions about this virus. We really appreciate it. Thank you.